We'll now be commencing with our panel discussion. I'd like to invite our panelists to the stage, and I'll be introducing them. Dr. Shilpa Aggarwal is an Indian and Australian trained psychiatrist with advanced training and extensive experience in child and youth psychiatry. She has been working as a consultant child and adolescent psychiatrist across leading institutions in Australia and for the past few years, and is currently affiliated with Mpower in Mumbai. She is passionate about improving public knowledge about mental health and is committed to optimization of mental wellness. She has published many scientific papers in the peer-reviewed journals in the field. She will be talking about mental health aspects of issues like cyberbullying. Next, we have Dr. Pooja Singh, who is presently working as Assistant Director of Health Services, Oral Health in the Directorate of Health Services, Mumbai, Government of Maharashtra. She has been involved in planning, implementing and monitoring National Tobacco Control Program in 34 districts of Maharashtra. She has also had the experience of working in public health for over 15 years in the state government. She and her team have implemented revised National TB Control Program, National AIDS Control Program effectively in the state. She is an MBBS and MD in Community Medicine from Brown Medical College and JJ Group of Hospitals. Next we have Mr. Vishal Gondal. He is an extraordinary entrepreneur and the founder of GOQii, which is a leading international company which offers coaching and fitness tracking services. He also founded India's leading gaming company, India Games, which he sold to Walt Disney in 2011. GOQii counts some of the leading technology investors and shareholders. Mr. Gondal has expertise in the intersection of healthcare and technology, and we would love to hear his views on how he sees technology impacting health. In 2012, Tech Circular included him in the 25 most powerful people in the Indian digital landscape. And in 2005, he was listed by Mobile Entertainment magazine as one of the top 50 executives in mobile content globally. Welcome. Mr. Anand Desai. Mr. Anand Desai is the president of Time Mumbai and the managing partner of the legal firm DSK Legal. Mr. Desai has extensive specialist experience in the fields of banking laws, financial services, M&A, intellectual property rights, media and entertainment, real estate and outsourcing issues. Mr. Desai advises various large corporates, funds, and high net worth individuals on various and diverse issues. He is listed as one of the leading lawyers in India in the Who's Who Legal, an international bar association publication for commercial litigation, real estate, M&A, and regulatory communication, and in Chambers Global PLC, which lawyer, IFLR, and in Asia Pacific Legal 500. We look forward to his views on the legal dimensions on the misuse of technology. Please give a round of applause for our panelists. Thank you, Dr. Pooja. We'll now be moving into a panel discussion, and soon after the floor will be open to questions from the audience. My first question is for Mr. Desai. How updated would you say the Indian law is when it comes to crucial aspects of social media abuse? And how are the law enforcement agencies perceiving cyberbullying as a concept?
So as I said earlier, the law typically develops after the problem occurs. That's the nature of law. It is developing, like I said, but cyberbullying is a very broad term because what may amount offensive to one person has no impact on another person. That's where the problem comes in any legal issue. It has to be a cut and dry situation. There may be some subjectivity, but generally it has to be cut and dry. In terms of law enforcement, like I said, if a crime is made out, at least in Mumbai, I guess most of you are from, we have a very good cyber cell, and there is distinct, clear possibility if the crime is committed from India, anywhere in India, it will be detected. If it is from outside, you can't do it.
My next question is for Dr. Pooja. Dr. Pooja, are there any experiences you'd like to share with us on when technology has been misused or had some kind of impact on mental health in the rural parts of India or the villages of India?
Technology, like in the rural parts of India, we did not get that many cases right now. But yes, from the urban, like the Mumbai and from the helpline, and we have many cases there. Okay, this helpline is run by the Tata Institute of Social Sciences, and there are many calls, and most of the calls are by the parents. Okay, who seek help for their kids, and there are not much in the rural areas. Yeah, the problems are different. The the problems are totally different. There are socio-economic problems in the rural areas, not much related to technology right now that we have come across. But this is a very important, this is a growing trend now. It is there in the trend, so we have to be careful. And if any such problem is there, then please refer, please come out. Okay, that is my appeal to all of you.
Thank you. So my question is to Mr. Gondal. Could you speak briefly maybe on the positive impact technology is having on our fitness and lifestyle? Maybe what are some of the trends you see? And how is social media driving us towards a more fitness-oriented lifestyle?
So as I said previously also, right, that social media is becoming an extension of your own self and your own life. It is almost becoming a parallel universe where you are living, which is why there are positives as well as negative aspects of everything. And I think just to focus on the positive aspects over here, today technology is going to empower you to do so many things. At one end, we are talking about using technology to create social revolutions, and we know about the India against corruption and Egypt and all the things which are happening. And we also know how Twitter is now happening and how people are saying the next world war may start with a tweet, not by the nuclear missile. So I think the bottom line is that technology and tools are going to be there, and they will be the good and bad use. Coming specifically on the healthcare use case, I think one of the biggest challenges, and I'm sure Dr. here agrees, that in India, we are the capital of heart disease, diabetes, all these things, and the doctor-patient ratio is very low. There are not enough doctors, and there is no way we can produce enough doctors or make enough hospitals for all the people who are going to have these lifestyle challenges. So the only way to help and treat lifestyle challenges is to use technology and tools, what is offered by stuff like WhatsApp, Facebook, etc., where people could create groups within themselves or work with what we call coaches or primary healthcare workers on digital platforms to improve their life and improve their health. And the beauty is, a lot of these tools do exist. It's just that today the focus of a lot of the social networks per se has been entertainment. But the good news is a lot of them are now looking at alternate use cases because as they extend. So Facebook, Google has a huge investment, for example, on health. Google is probably spending billions of dollars on all kinds of new health initiatives. A number of tech companies are looking at health tech in a very, very big way. So we'll be seeing billions of dollars being invested on technologies which are going to make you healthier and emotionally much better. In fact, I know somebody who has recently created a very interesting app. That app can detect on your phone if you're depressed. That's it. It is basically, the algorithm can figure out your motion and movement, and they know what a movement of a normal person is and what a movement of a person who's depressed or likely to be depressed is. Or they could look at your behavior on social media and look at other things and detect these kind of things and send that data to experts. So the good thing is, there are all kinds of sensors which are coming in within your phone as well as within using big data services, which are going to be used for the positive aspects. Of course, these same sensors and same big data can be used to identify cyber bullies and kick them out. I think one of the things is you have to understand that please report people who cyber bully, because once any social media gets input that a person has been reported 4 times, their accounts get blocked. And you know that's already happening in all social media companies are doing it. So I think that is most important.
My next question is for Dr. Aggarwal. As a mental health professional, what's your message to educators and the students seated here, and how is the mental health community coping with the growing menace of cyberbullying and misuse of social media?
Alright, I'll take the second question first and then go on to what are the measures that can be used. As far as the mental health community is concerned, I think there are a lot of positive aspects of technology that were just mentioned that can be tapped into to make mental health practices and mental health support system available to everybody and reach out. So we have got a lot of, for example, WhatsApp groups, support groups happening for mental health. there are depression groups, there are groups for victims of cyberbullying. In addition to that, there are some specialized clinics that have been set up, especially for example, for internet addiction. There is a specialized clinic that has been set up at AIIMS. And these are some of the initiatives that are just starting to come into picture now, and it would take a bit of time for it to spread out and reach out to everybody, but at least it's a good start. In addition to that, there are other apps, as was just mentioned, that there are apps which can actually pick up and which can help in diagnosing depression. Of course, it is not going to be 100% accurate, but similarly, there are other apps. One of the apps that I was reading about is Rethink, where the messages being sent, if somebody is sending an offensive message, some of the bad words get picked up, and the person who's sending the message, that person is encouraged to go over the message again and think twice before posting it out on the internet. So these are some of the initiatives that are there. Not there, as I digressed from the mental health initiatives to some of the general initiatives that need to be tapped into by the mental health community so far. They haven't been tapped into, but they need to be tapped into in future. So those are some of the things that are happening. In addition to that, when I'm working at Mpower now, which is a child and adolescent mental health center. So we run specialized services for young people who are going through some mental health concerns, and we make sure that if somebody is presenting to us, we are very sensitive towards these issues, and we definitely make it a point to screen everybody who walks into our center for any bullying that could be happening, cyber or even physical form of bullying. Coming to the next point, how can we make people who are sitting here more aware, or how can we, one, prevent it from happening and make them more aware if at all it is happening? I think the first point is to be sensitive and to have the basic etiquettes very clear of using any technology or using any cyberspace. So that goes back to the time we start using it, and it goes back to the time when it needs to be incorporated very well in the education system, starting from that point on. In addition to that, I think there could be clear telltale signs that I just mentioned about. If there has been a change in the behavior, change in the pattern of the use as far as technology is concerned, if somebody is becoming very fearful to use their cell phones or go on their social media account, or in the friends group, if somebody else has picked up that there has been some bullying going on, I think it is important to acknowledge it, recognize it, and offer support and offer help, because there is help available.
It's actually interesting that you mentioned Rethink, because I read about the app as well, and they actually had a turnaround of about 94 to 97%.
Yeah.
When the people actually reconsidered what they were posting. Yeah. So I think that's a great solution. That being said, the floor is now open to the audience. If you have a question, you may rise and maybe give a short brief introduction and address it to one of our panelists here. And you're also free to stand up and speak about the theme of the conference as a whole, if you like to say anything. Are there any audience members who'd like to ask a question or speak on the issue?
Good morning. My name is Neha, and I'm from the BA batch of XE. It's sometimes that we don't understand the level of bullying. It might be just a slight comment or something, and we might just ignore it, or we might see our friend doing that. So first is like, what's the immediate reaction to that? Either we just ignore it, or how can we just get over it? We just keep thinking about it. I have personally gone through that. And secondly, if we see one of our friends going out of that, how do we help it?
Thanks very much for your question. I'm impressed that you could share your personal experience. I think it is very important that if something is playing on your mind for some time, one, communicating with a person you trust. Sometimes it can be hard to figure out if you are being oversensitive towards something, or if it is a real bullying that is happening, and it should be taken seriously. So I would suggest that communicate with a person you trust. You can discuss it with them. And also, there is generally a pattern. If somebody is being rude to you all the time, it has happened on multiple occasions, then it doesn't leave any space for any kind of doubt. They are actually getting into a pattern where they are putting you down all the time and they are being verbally aggressive towards you. Then it would qualify for bullying. But having said that, it is important to also, if you know the person, one of the things you could do is communicate with the person, that is if you feel absolutely comfortable in doing it, to understand their point of view or their perspective. But if you have discussed it with a person you trust, and they also agree with you that this does qualify for bullying, then it is bullying. And if it just keeps on playing on your mind, it is definitely not acceptable and it is not right. And the second part was if you see somebody else going through a similar thing, I think it is either going through a similar thing or doing the same thing to another person. He is also facing the same thing. So again, I think it is important to see the pattern, discuss it in detail, what the exact concerns are, and see there is, I feel that some rudeness has become acceptable in today's lingo and the language that is being used on WhatsApp and other social media, but at the same time, if it is hurtful to another person, that does qualify for bullying. So if your friend is going through a similar thing and another person is constantly sending messages which are rude, which are mean, then it would qualify for bullying.
Thank you. Are there any other audience members willing to state something or ask a question?
Hello, good afternoon. I'm Saili Karida and I'm a PG student, a postgraduate student. So in continuation to Sneha's question, I wanted to ask that the measures that you told, that sharing it with somebody who's close enough, who you trust, is one thing, but what are the legal measures, like after that, once you have shared it with someone, what are the legal measures?
So like I said, if it qualifies as intimidation, extortion, if you feel that your reputation is being spoiled in public, so it's posted on a public platform and your reputation is getting affected, you have a remedy of defamation because your reputation is being adversely affected. So defamation, you have both criminal and civil remedies. So there are legal remedies, but the challenge, like I said earlier, is actually identifying which bucket you fall into or what is the offence that's been committed. And that's the biggest challenge for the police as well, because if you go with a general statement to say, I believe I'm being bullied, the question is going to be how? Why do you say that? When you show something on a social media platform, they may say, what's the big deal? One more thing I must tell you, the police generally is much better now. But generally, they need to see some blood or something to react. That's the way they're trained. They need to see an accident, they need to see a murder, then they react. So something like a copyright infringement or defamation is not so clear to them as a crime. It's not something they deal with very often.
Good afternoon, thank you so much. So mental health in India and in, I feel, educational institutions is kind of like a taboo subject. People are still very hesitant, and unfortunately it's these institutions where bullying is like, it's the root of it. So how do you all think that in today's world, how such educational institutions like schools, colleges should incorporate like something to create like a positive image about mental health and counseling and psychology?
So I would say design plays a big role in this, and when I say design, it's about presenting the problem in a positive way. For example, if there is an app which says this app is for people who are facing depression, nobody wants to have that app on their phone because people think that, oh God, I'm using this app, something is wrong with me. Or for example, in the case of GOQii, he never ever said that GOQii is for weight loss or it's for this or it's for diabetes management, because the insight we had was nobody wants to wear a device and say this device is for diabetes management and tell the world I have diabetes. So this is not just with mental health, but all kinds of health situations where people do not want publicly to be associated with it, which is where design and, let me say, using existing platforms or platforms where people are not segregated in boxes kind of helps. Of course, if you are having a very severe case where a real treatment is required, that could be a case. For the general population, what we do is they are not differentiated and they are all part of the same program, and they may have different treatments or different, let's say, coaching plans.
Another point to keep in mind, as far as specific to mental health is concerned, the government is coming out with various initiatives as far as the educational institutes are concerned. They have recently launched the National Adolescent Mental Health Program, which is the Rashtriya Kishore Swasthya कार्यक्रम, under which counseling services are mandatory to be made available in all the schools. And similarly, in addition to that, I think they are trying a bit to make the schools a bit more aware of the mental health programs, mental health problems in adolescents and young people. I know that it is just a baby step towards what needs to happen. The schools need to be sensitized a lot more. The educational institutes need to come on board as far as the mental health problems are concerned. But I think it is a step forward in the right direction.
Just to clear, mental health is not a taboo subject anymore. Okay, as we all know about the non-communicable diseases, okay, which are on the rise in India and everywhere right now, like heart disease, okay, then there's diabetes, cancer, okay, kidney ailments, like that. Mental health has been included in this non-communicable diseases, and if this program has been launched a few years back, let me tell you that the mental health control, the awareness program has been launched in 1993, and from that time the government is taking active steps. Okay, and the first and foremost thing is awareness of the mental health, and this program is being implemented all over India. In the rural areas, people are coming out with their problems. Like as I told you, out of 10, around 4 of them are having symptoms pertaining to mental health. And in the urban areas, of course, you have to come out with the problems. There are many teams designated for schools and Anganwadis in the rural areas where they actually conduct counseling sessions. Okay, in the schools, in colleges. Okay, so the awareness aspect is there. Secondly, they have increased the human resource for this particular program. Doctors are trained. You know, after being appointed, their capacity building is being done. Okay, so they have been trained, and there is awareness created at the village levels also, in the schools, in colleges, and it is not a taboo subject. You need to come out with your problems, and there is always a treatment for that.